These two steroids can potentially save your life from COVID-19. In the high-stakes fight against COVID-19, the latest information from our top doctors and scientists is crucial in saving lives and putting a halt to the havoc wrought by this global pandemic. With U.S. and worldwide cases at 25.3 million and still rising exponentially, every bit of information could mean the difference between life and death. In this video, we go over the breaking news about these two steroids that can potentially save your life from COVID-19. Welcome to Trending's Finest, where we give you the hottest updates on the world's most viral news, videos, and stories in the most exciting format. Click that subscribe button and hit the notification bell to not miss a single beat of the world's pulse. Studies around the world have confirmed that steroids can save lives in the COVID-19 pandemic, leading to new recommendations from the World Health Organization that doctors should give them to severely ill patients. Find out the names of these two miracle and, more importantly, cheap drugs, the science behind these life-saving results, and exactly when they should be used. Stay tuned. Conclusions of the study. In June, the recovery trial run in most NHS hospitals and led by Oxford University found that the lives of 1 in 8 people sick enough from COVID-19 to need a ventilator could be saved by a steroid called dexamethasone. Now, combined results from that trial and 6 others have confirmed those findings and established that at least one other equally cheap and widely available steroid, hydrocortisone, also saves lives. The study. The new studies include an analysis that pooled data from 7 randomized clinical trials evaluating 3 steroids in more than 1,700 patients, carried out by a WHO working group that is making efforts to rapidly evaluate COVID-19 therapies. The study, published in the Journal of the American Medical Association, concluded that each of the 3 drugs reduced the risk of death. Steroids like dexamethasone, hydrocortisone, and methylprednisolone are often used by doctors to tamp down the body's immune system, alleviating inflammation, swelling, and pain. This helps because many COVID-19 patients die not of the virus, but of the body's overreaction to the infection. The drugs are already widely being used. In May, about 7 to 8% of COVID-19 hospital patients were getting dexamethasone, and by the end of July, it was about 55%. Take note that this is not a drug that costs $3,000 to reduce a hospital stay by a few days. This is not anywhere near the sort of cost in many other areas of acute and preventative medicine. So this is a widely available, widely useful strategy. I mean, treating people with dexamethasone is, give or take, $1 to save a life. The hydrocortisone trials were led in the UK by Professor Anthony Gordon of Imperial College London, an intensive care specialist. Patients were enrolled in 88 hospitals. They began to look at hydrocortisone because it's an anti-inflammatory drug. In severe cases of COVID-19, the immune system can go into overdrive, attacking the body's own tissues and causing inflammation. This is because steroids are often used to treat inflammatory conditions and severe infections in intensive care. But they can also suppress the immune system. And with a new virus that none of us were immune to, that could make things worse. Steroids can have harmful side effects, especially in elderly patients who make up the majority of the very ill coronavirus patients. The drugs may leave patients vulnerable to other infections, may raise blood glucose levels, and may cause confusion and delirium. When the recovery results came out in June and Gordon's team looked at their own data, which came to much the same conclusions, they stopped recruiting to the trial and continued with wide-scale implementation. The Oxford University recovery trials discovered that dexamethasone improved the survival rates in severely ill patients. Researchers had hoped that other inexpensive steroids might help these patients. Lead author of the meta-analysis and professor of medicine and epidemiology at Bristol University, Jonathan Stern, agrees that steroids are a cheap and readily available medication, and the analysis has confirmed that they are effective in reducing deaths among people most severely affected by COVID-19. He emphasized it was really very unusual in science, one may say groundbreaking, for groups working on separate trials to combine their results together in this way rather than publishing separately, as they've done in order to establish whether the drugs can save lives in the pandemic. Keep watching to learn the detailed results of this large-scale study, when these drugs should be used and when not to use them. Stay tuned. The results. Overall, the scientists said, the new studies appeared to confirm the promise of this class of drugs for patients severely ill with COVID-19. The drugs reduced the risk of death in these critically ill patients by 20%, a drop from 2 deaths per 5 patients to 1 in 3, according to a meta-analysis of results of the 7 trials covering a total of 1,703 patients, published in the Journal of American Medical Association. Dexamethasone produced a 36% drop in deaths in 1,282 patients treated in 3 separate trials, also published separately in the journal. Hydrocortisone, tested in 374 patients in 3 trials, appeared to reduce deaths by 31%, and a small trial of methylprednisolone in 47 patients resulted in a 9% drop in deaths. The results were consistent across the trials and show benefit regardless of age or sex. They characterize the quality of the evidence in favor of steroid treatment for severely ill patients as one of moderate certainty. Among the other studies published was a Brazilian trial of 299 patients with acute respiratory distress syndrome that compared dexamethasone treatment with regular care. The steroids significantly improved outcomes, increasing the number of days patients were alive and free of mechanical ventilation. Another study in France evaluated low doses of another steroid, hydrocortisone, in 148 patients. Those receiving the drug were more likely to survive, but the results were not statistically significant because the trial was stopped early. A third study tested varying hydrocortisone treatments in 400 seriously ill COVID-19 patients in 8 countries. It was also stopped prematurely, but researchers concluded there was a strong probability that the treatment improved outcomes. Corticosteroids should now be the first line of treatment for critically ill patients, the author said. The only other drug shown to be effective in seriously ill patients, and only modestly at that, is remdesivir. The NHS and other health providers around the world are likely to adopt the use of either dexamethasone or hydrocortisone for severely ill COVID patients, depending on which drug is more available and familiar to doctors. According to NHS Chief Executive Sir Simon Stevens, one of the distinctive benefits of having the NHS is that we've been able to mobilize quickly and at scale to help researchers test and develop proven coronavirus treatments. Like what was done with dexamethasone, the NHS will now take immediate action to ensure that patients who could benefit from treatment with hydrocortisone do so, adding a further weapon in the armory in the worldwide fight against COVID-19. Recommendations. Based on the new evidence, the World Health Organization issued new treatment guidance strongly recommending steroids to treat severely and critically ill patients, but not to those with mild disease. The WHO warned against indiscriminate use of steroids, emphasizing that patients who are not severely ill are unlikely to benefit and may suffer side effects. Unwarranted use could deplete global supplies, depriving patients who genuinely need the medications. It's also important to note that in clinical trials, only the sickest patients were treated with steroids, and it's not certain that those who are less ill will benefit or be harmed. The optimal doses and duration of treatment also need to be identified. Martin Landry, professor of medicine and epidemiology at Oxford University and deputy chief investigator of the recovery trial, said the time for doctors to use steroids was the moment they reach for the oxygen cylinder for a patient who needs help with breathing without waiting for the move to a ventilator. Dexamethasone is generally safe. It presents a favorable benefit-risk profile, particularly in patients with severe forms of pneumonia. While the benefit is less prominent in patients with non-severe pneumonia, as the treatment is short even at high doses, corticosteroids are not associated with serious side effects. Potentially higher blood glucose levels, hyperglycemia, are temporary. Prolonged use, more than 2 weeks, may be associated with adverse effects such as glaucoma, cataract, fluid retention, hypertension, psychological effects like mood swings, memory issues, confusion or irritation, weight gain, or increased risk of infections or osteoporosis. To reiterate, all these adverse events are not associated with short-term use, with the exception of hyperglycemia that can worsen diabetes. Clearly, now steroids are the standard of care, reiterates Dr. Howard C. Bachner, the editor-in-chief of JAMA, which published 5 papers about the treatment. Todd W. Rice, critical care physician at Vanderbilt University Medical Center, who is not involved in the studies, finds these life-saving treatment results electrifying and full of hope that we may be gaining on this virus. What do you think? Are we truly gaining on this virus? How are you coping? Tell us in the comments down below and let's make a conversation out of it. Now that you've learned about the do's and don'ts of steroids for fighting against COVID-19, you should check out the 2 big don'ts in our other video. Commonly used face protection you've likely seen has been proven ineffective for preventing COVID-19 spread. Here you'll find out what you should have been avoiding all along, including the science behind it, and most importantly, these science-backed CDC recommendations to keep yourself and your loved ones safe from this dreaded disease. Watch it now. Thank you for watching. This is Trending's Finest. Always the trendiest, always the finest.